Hello, everybody. I'm Joshua Crawford, the founder and lead instructor of Level Up Medic. You're in the right place. You're here to learn about the EKG Mastery Challenge. Congratulations on taking that first step. Now, the fact that you're here tells me you're ready to learn more. You're ready to go to that next level. You're tired of being stuck with just limited knowledge. You're already ahead of the game. So I want you to stay right there. I need to talk to some of your friends. See, you already have the awareness that you need to learn more, and you know why you need to learn more. But there's another group of people. I've got to talk to them for just a moment. Right now, they lack the awareness that they need to learn more. Now, I didn't say that one group needs to learn more and another group does not need to learn more. I said there's one group who has the awareness and another group that doesn't. Now, listen up, my friends. I want to show you where most people are when they come into my world of EKG Mastery, especially the EKG Mastery Challenge. Now, most people, when they come here, they've been taught maybe 25, 30 basic rhythms. Maybe they know first, second, third degree AV block. They know how to recognize a STEMI, hopefully. But their knowledge is very fragmented and limited. And so they take that limited knowledge and then they try to apply a protocol to it. Basically like flipping pages in a recipe book. And they say, okay, I think I have this situation. All right, so let's turn to this page and we're going to pull out this protocol and we're just going to apply this protocol. And you say, well, why are you doing that? Does that make sense for this patient right now, today? And they say, I don't know, but that's what they told me. I'm just doing what they told me to do. Well, guys, there's a much better way. You don't want to just have information. And that's the situation with so much of medicine today is people just have information, but they don't really have understanding. Now, notice what I said. I said information. You just have random facts floating in your head, but you don't have organized facts. You don't have the information organized in a way that you know how to apply that information throughout the body. You lack understanding. Now, see, your patients even are singing to you. They're saying, medical provider, please, I'm crying out to you. What I need from you is understanding. And they say, guys, it's as simple as 1, 2, 3. Understanding is what you need. So I want you to be honest with yourself for just a moment. It's not about being honest with me. Be honest with yourself. Let me ask you some questions. Your current level of knowledge right now, is it enough? Do you feel that you know enough? Do you know all that you need to know in this vast sea of information that we call medicine? Do you know what you need to know? Is your understanding enough? What does your gut instinct tell you? Are you really giving patients the best possible chance? Remember, you can only help patients up to your level of knowledge, but your level of knowledge may not be enough. You can only help patients to your level of knowledge. You can't give what you yourself don't have. Now, in the last, let's say, 12 months, in the last 30 days, in the last week, what have you done? What steps have you taken to learn more? Did you even know that you need to learn more? For instance, are you the type of person that says, oh yeah, the patient has a normal sinus rhythm when I look at the EKG. Patient, you're good. You're not good, but you're still good. That's another song, right? How many times do we look at a rhythm and say, oh, we don't know what else to call it. It fits the criteria. We're going to call it a normal sinus rhythm. Send that patient on their way. But all normal sinus rhythm is not optimal. See, the thing is, you will not find in the EKG what you haven't been trained to look for. Let me say that again. You will not find in the EKG what you don't even know to look for. Excuse me one moment. And maybe you haven't been taught. Perhaps your teacher didn't know. But here's what I want you to know, that the best people in every industry, in law, in medicine, in music, in aviation, business, the best people, the people who rise to the top, they all have coaches, they all have teachers, they all have mentors. Well, let me ask you, who is the person in your life that's continually teaching you, helping you level up so that you can become better? Are you over there just kind of like most people, taking the cookbook, taking the protocols, and just throwing them at patients? Do you even understand the protocol? Well, would you like to have a deeper understanding? For instance, what's the connection in the EKG? How is it linked to seizures, diarrhea, to muscle cramps? It all comes down to cellular physiology. See, the same information that's showing up in the EKG is giving you information to tell you what else may be going on in other parts of the body. Let's give you another example. Why do we use benzos and barbiturates for certain types of seizures, but we use calcium channel blockers for other types of seizures? Or let's go to the heart. Let's say we're talking about the top chambers of the heart. So you've got the atria and then you have the ventricles. Let's say we're up here in the atria. Why do we treat those arrhythmias one way, and for ventricular arrhythmias, we treat them differently? Well, what determines that? There again, it's not just a protocol. It has to do with the underlying cellular physiology. Well, why not learn from somebody who studied this and taught this to thousands of people over the years? In fact, I've been studying this one topic for the last 14 years, and I've taught thousands of students to date. I've taught many of you. Why not learn from somebody who's not only taught a lot of people, but who has poured thousands of hours and hundreds of thousands of dollars, literally, into truly understanding not just EKGs, but more about medicine overall? No joke. Well, that someone is me, Joshua Crawford. A former paramedic educator, a flight paramedic who went to med school, even taught while in med school. Now, if that's something that interests you, say yes. Now, are you saying yes to me? No, you're saying yes to you. You're saying yes to your patients. You're saying yes to improving. You're saying yes to becoming better. You're saying yes to really understanding. See, when you got into healthcare, you said you wanted to make a difference. You said you wanted to help patients. But what if I told you that your lack of knowledge, not only is it harming patients, it may kill patients? Now, I know you didn't mean to get here. You didn't plan to be where you are today. Life happened. You got busy. You were just trying to get through the day. The last thing you wanted to do is take another class. The last thing you wanted to do was go get some more information from a boring teacher. I get it. I get it. I see why. I see why you may be struggling. I see why you're stuck. I see why your knowledge has kind of plateaued. But I was there too at one point. There was a time period where I had gone through years of medical school. It's now time to take my board exams, and I had so much information coming at me. I had, just like you, I had gone to class after class after class. They just shot information at me. They give me a test, and then you take the test, you pass. It doesn't really matter your score because the test doesn't test all the possible information. They say, do you know enough to just be safe and not kill off everybody? And so you just keep advancing through your career. And then congratulations, they say, all right, you've graduated, you've made it. But remember all that information that you never went back and learned. You never went back and understood, but you just continue moving forward, right? Well, I met a mentor who taught me to really understand. The best thing my mentor taught me is he said, son, I want you to go back and I want you to learn normal for yourself. I want you to know about the cellular physiology. And then I want you to take that information and apply it all over the body, in and through the body. I want you to really understand. Well, if you'll join me, I will teach that same thing to you. Now, let's talk about the EKG Mastery Challenge. So let's pull that up on the screen. Well, first of all, so the EKG Mastery Challenge, let's break that down. EKG Mastery Challenge. It's a challenge where I'm going to teach you to master the EKGs. The EKG. Now, You're not going to be an expert in those 5 days. I've been studying this stuff for over 14 years. But your knowledge is going to be at a much different level than it is today. I can promise you that, especially if you do your part. Now, the EKG Mastery Challenge, it's where we come together live every day for 5 days. We're going to spend 2 hours a day for 5 days, and we're going to really know this EKG. You've got a couple different options to access it. It will be live online every day, and I'll talk more about the options in just a moment. Now, when I say a challenge, it's going to be challenging. You're going to have to do some work, because I don't want you just getting information. I want you to get some practice so that number one, you get the understanding, but also if you have questions, that's the time for you to ask me, so that I make sure that when I send you out, you're armed and ready, and now you can truly make a difference. You can truly help more patients. So we're going to learn together every day, and then you'll go home and you'll do your little homework. It's quick. It only takes a few minutes, but it's to get you that practice that you need, okay? So let's go into the site for just a moment. So the site is levelupmedic.com. More than likely you're here. If you're not there, just go to levelupmedic.com or click the link surrounding this video. Now, on day one, we're going to lay the foundation, because I recognize that people come to me at various levels. It doesn't matter if you're a doctor, a mid-level, let's say a nurse practitioner, PA, you could be a paramedic, a nurse, a student, you can be an EMT, firefighter, it doesn't matter what your level is. The struggle is the same for everybody. I've worked with nurses, I've worked with doctors who don't have a clue. It doesn't matter. Paramedics, it doesn't matter. We're going to lay that foundation. So we're going to go into the anatomy, the physiology. We're going to go deep into the cardiac conduction, the blood flow, and all of that, because I want to make sure that everybody is at the same level, so that as we continue on through the week, you're more prepared. On day two, now is when we really kind of get into the nitty-gritty of the paper and the leads and all of that, the lead placement. For instance, how many of you have had somebody else actually put the patient on the monitor, stick the electrodes to them, but come to find out they put the electrodes in the wrong spot? Well, would you even know? Do you know what you're supposed to look for to tell if the electrodes are even placed properly? Like, for instance, I'm going to tell you what every single lead, we're going to break down all 12 leads of the 12 lead, and I'm going to say, okay, well, what is this looking at in the heart? You're going to get information about every lead. I'm going to tell you what each lead is supposed to look like, and tell you how to recognize if something's wrong in that lead. We're going to talk more about the waves, the intervals, and segments. See, I don't want you just knowing that same information, the same old stale stuff that everybody else says. Oh, P wave is atrial depolarization. QRS is ventricular depolarization. And I say, well, what does that even mean? Well, I don't know. That's the words they told me. I don't want you just repeating things that you heard somebody say. I want you to understand, what is depolarization? What is repolarization? What is hyperpolarization? What's overshoot? What's undershoot? What's actually going on inside the cell? What moved in? What moved out? If there's an issue, what did not move in or out, and so forth. On day 3, now it's starting to ramp up. So we're going to take a walk through the heart systematically. And when we're up here in the top chambers in the atria, I'm going to say, okay, what if this is the pacemaker, or this is the pacemaker, or this is the pacemaker site? What do you call that rhythm, and what's it going to look like, and why? Then we're going to come down to the AV node level, and we're going to talk about the junction between the atria and the ventricles, and I'm going to tell you about the junctional rhythms, and then we're going to go down in the ventricles, and I'm going to tell you about everything that's going on there. But you're not just going to recognize rhythms as shapes. You're going to actually understand the physiology, because you have to understand the physiology to tie in the pharmacology. So now, when we talk about it, I'm going to show you, why do we use certain medications in the atria, different medications in the ventricles? When are times where You can use a certain class of medications in both places. I'm going to tell you all of that. Now, day 4, this is where it's really starting to ramp up. On day 4, now things, all right, we've laid the foundation. We've gone over the basics. Now we're in the heavy stuff. We're going to go over like AV blocks in a way that you haven't seen before. I'm really going to explain, well, what is axis deviation? For instance, okay, let's say this person has left axis deviation. I don't want you to just know it for information. I want you to think critically and say, wait, what's going on with this patient? Do they have maybe aortic stenosis? Do they have chronic hypertension that I need to look at? We're going to look at ventricular hypertrophy, atrial dilation, atrial enlargement. We're going to really know 12 leads, and I'm going to show you a really fun way and a really kind of cartoonish way, but it's a lot of fun, and I'll show you an easy way to understand 12 leads. Now, on day 4, on day 4, I'm going to teach you, so we'll all come together. Those that are in the general admission, so they'll be on the Facebook group, we'll end the live stream for them, and everybody that's the VIP, you're going to stay on, and I'm going to do another session with you on day 4, about 25 to 30 minutes, where I'm going to teach you the most important concept in all of medicine. I'm literally going to teach you about chronic diseases, how it happens down to the cellular level, and we will literally go through the entire body, and I'll show, okay, well, what happens in the brain? What happens in the heart? What is going to be the most common cause of death if this progresses? I'm going to show you about what's happening in the lungs, what's happening in the kidneys, what's happening in the breast, the uterus, the testicles, and so forth, what's happening in the skin. Guys, this is going to be a lesson. You don't want to miss this. Only the VIPs will even have access to it. And then finally, on day 5, it's time to wrap everything nicely and send you on your way. So we're going to talk about electrolyte abnormalities and medication effects. We're going to talk about other chronic conditions and how they show up in the EKG. So for instance, I'll show you, okay, what should you expect in the EKG of let's say a COPD patient? All right, if we continue down the site at levelupmedic.com, it'll tell you about all the time, so pay attention to your time zone. People will be joining from around the world, so make sure you're there on time based on your time zone. There'll be a couple testimonials on the site. One of them is from a patient. You really want to check out Kevin's story. And then the other one is from Dr. Ryan. Dr. Ryan and I were actually in med school together, but I remember when he started, I was a little ahead of him, and I ended up teaching him, among several hundred other students, about EKGs. Now, let's go. All right, so there's more information about your instructor. That's me. Now, let's get into right here at this section where it says purchase your EKG Mastery tickets below. This is where you'll go to actually sign up. If you'll look at this first part, there's a part where it says general admission. Let's talk about that for a moment. So the general admission, this is where you get all 5 days of learning EKGs, but you'll still be online, but your access is strictly through Facebook. So this will be live streamed through a private Facebook group. You will come there and you'll do all 5 days. You'll do everything in the Facebook group. Now, this class by itself has over a $1,500 value, really, for the level of information that you're getting, because we don't just cover EKGs, especially like you've had EKGs in the past. We're really taking it to the next level. So you're getting about $1,500 of value in the class itself. As a general admission ticket holder, you'll also have access to the Facebook group. That's where you'll just basically watch the challenge. You'll be able to listen, you'll be able to see the information, but you don't really have as much engagement. You're not able to really ask questions. You will get access to the daily workbook, and all together, you're getting about $1,600 of value, but of course, you're not going to invest $1,600. For you, it's $97. So about the cost of dinner for two for 1 day. You're going to have access to information that you'll use the rest of your entire career. So that's general admission. Now, I want to spend the most time talking about this section in red, the VIP admission. This is where you really want to go. Okay, this is where it's going to be the highest level of value, and it's truly a transformational experience. We've put so much time and effort and energy into making sure that when you leave, you're very well prepared to be able to interpret EKGs in a way unlike ever before. So what are you going to get at the VIP level? Excuse me one moment. At the VIP level, you still get access to the same 5 days of the EKG Mastery Challenge. There again, about a $1,500 value. You'll have access to the Facebook group, but you're going to do everything on Zoom except for the after class experience. So everything during the session, you'll be live online on Zoom. You'll have the ability to ask questions, get your questions answered. We're going to do games every day. There will be prizes every day. Some of the prize winners will get prizes valued at a couple $100. And then we have lower level prizes as well. But there'll be some prizes, there'll be games. It's just going to be a lot of fun. There's a kickoff session on the Sunday before, where I'm going to tell you it'll be about a 30-minute session on the Sunday before the challenge starts, where I'm going to say, okay, guys, this is what I want you to do tonight. These are some props I want you to have. It's real simple things, but it's a part of the overall experience. I don't want to spoil the surprise, but it's a lot of fun. Okay, let's see. Oh, and then on the Thursday, as I mentioned, you're going to have access to that bonus session, where that's where I'm going to teach you the most important concept in all of medicine, and only the VIP ticket holders get that, and that's on that Thursday of the challenge. Don't want to miss this. But here's the other thing. I understand that life happens sometimes. Things will come up. I want you there. I want you locked and loaded. I want you to go play full out. But I understand that you may have to miss a day for work obligations or scheduling conflicts or whatever else may happen. If you're a VIP ticket holder, you'll also have access to the daily recordings, and you'll have access to those recordings for an additional week. So an additional 7 days past the challenge. So let's go back over this. As a VIP ticket holder, you're going to get the 5 days of the EKG Mastery Challenge live on Zoom with me. A lot more engagement. You'll have access to the Facebook group. That's where everybody will go, general admission and VIP. Everybody goes to the Facebook group, and that's how we'll connect after class. You'll have access to the daily workbook. The daily workbook, for instance, here, let's pop that up on the screen. The daily workbook will systematically kind of go through day by day, and there'll be different graphics and so forth that you'll kind of fill in. Like, for instance, when we get this, will be on day one or day two, where we're talking about the lead placement and all of that. And so you'll be drawing all over this nice, handsome young man. So that's the workbook. You'll have those live sessions with me. Remember, we're going to have a lot of games, and there'll be prizes for the VIPers. You'll be able to ask questions in real time. I will answer as many questions as possible. Now, obviously, there are a lot of you, and that's one of the reasons we have to place a limit on how many VIPers we have, because there are a lot of you, and I want you to have the best possible experience, and I want to be able to have time to answer your questions. Remember, again, you get that bonus session on day 4. That's about a $6,000 value. I literally paid over $6,000 to get this information. And you'll have access to the daily recordings for an additional 7 days after the challenge. So that's about over $8,000 value for VIP. But your investment is not $8,000. Your investment is just $397. So for all of that, you're going to have an opportunity to invest in yourself, to learn more, to grow, to really understand medicine, and especially EKGs in a way you've never understood before. Okay? Now, so you now know what to expect during the challenge. I've summed up the EKG Mastery Challenge, given you the highlights of it. But what's most important is not all the stuff you're going to learn, and you're going to learn a lot. I promise you that. But what's most important is why. Why are you doing this? Now, Some people are asked the question, well, what do I have to lose? And I would say, well, let me help you for a moment. If you want better results, if you want better solutions, you have to ask better questions, okay? The right question, or a better question, would be, what do I have to gain? What do you have to gain by investing in yourself? Now, this is something you probably didn't expect me to say, but what if I said you should expect to get better pay? What? What do you mean? If I take this EKG Mastery Challenge and I learn more, I should expect to get better pay? Well, here's the thing. You get paid according to the value that you offer in the marketplace. That's why, for instance, why do doctors have a certain income? Why do nurses or paramedics have a different income? It's not based on the self-worth of the individual. It's based on the value or the perceived value that you offer into the marketplace. You should be willing to invest in yourself so that you get to learn more. Now, sometimes your employer will see that. They'll recognize that additional value that you now have because of your enhanced knowledge, and they'll pay you more. But sometimes you'll take matters in your own hands and you'll say, hey, you know what? They don't recognize my worth. They don't recognize the value that I bring with my enhanced knowledge. I'm going to find a new job, or I'm going to find a new career, or maybe I'll start my own business. But it starts, no matter what you're going to do, it starts with you becoming better, you knowing more. Now, I can't guarantee that you're going to get better pay, but that's one possibility. Another possibility, though, is you're going to be able to offer better value, for sure, to your patients. Not a possibility. It's likely. You should fully expect that you're going to be able to help more patients because you know more. See, you learning more is a win-win-win for everybody, to include you. Now, I recognize that you're an adult, you're smart, you can probably recognize when an opportunity is good for you. And let me tell you how I would approach that. Ask yourself, me investing in myself, me learning more, does it get me closer to my dreams, the vision that I have for my life, or does it take me further away? And only you know the answer to that. You learning more, does it help you or does it hurt you? Does it help your patient or does it hurt your patient? I think you need to answer that for yourself. Now, some of you say, okay, Joshua, I'm ready. What's next? Great question. Great question. You have three options. As I see it, you have three options. Number one, remember we were talking earlier about some people are aware they need to know more, some people are not. But since you are aware that you need to know more, you have three options. Number one is do nothing. Take this information, say, you know what, Joshua, I'm good. I don't need to know anymore. My patients don't deserve any more. I don't deserve to know more. Well, I'm going to keep my knowledge where it's been for the last 5, 10, 20 years. I don't want to know anymore. And I'm going to say, I wish you all the best. I hope I get to meet you someday. Good luck. Okay, that's one option. Option number two is you say, okay, I know I need to do more, but I'm just going to figure it out myself. And I said, okay, that's a possibility. I just can't tell you how long it's going to take because I know what I had to do is I had to invest thousands of hours, literally hundreds of thousands of dollars over the years. I had to read books. I had to watch videos. I had to go to conferences. I had to seek out teachers and mentors and coaches. It was a considerable time investment, a considerable energy investment, a considerable resource investment. That is an option. But there's a different option. Would you be willing to let me help you? Now, my guess is since you've made it this far, you've now recognized that not only can you learn more, you should learn more. You must learn more. But there's a different group of people who not only say, I can learn more, I should learn more, I must learn more, but there's a group of you who say, I will learn more. All right, Well, here's what you're going to do. Congratulations for taking a bold move toward your own future. Here's what I want you to do. You're ready to move forward. You know you're ready for more. You've decided to take action and join us today. Click the link. Click the link for the VIP. Don't even worry about the general admission. That's just there as an option, as a last-ditch effort. But the best value is for you to sign up as a VIP ticket holder. Join me on this EKG Mastery Challenge. But don't just join. This is not just a class. The purpose of this challenge is for you to be transformed, have your mind renewed. I want to raise your level of understanding. I want to take your knowledge to a place that you've only dreamed of. And I promise I can help you do that. So I want you to go clear your calendar. Make sure you're ready. Make sure you are ready to play full out. Now, what I can tell you is I will do my part. I promise you that. Every day I'm going to pour as much into you as possible. The only thing I ask you to do is do your part. Click the link right now. Sign up for the VIP ticket holder for the EKG Mastery Challenge. We start very soon. I will see you. And VIPs will kick off on Sunday. Everybody else, you'll kick off on the Monday. I'll see you soon. Have an amazing day.